Hello and welcome. I'm Dr. Adam Dorsay, a psychologist in Silicon Valley and the host of SuperPsyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. SuperPsyched is your tool to get more of what you want in your life and less of what you don't. This week marks 24 years since the tragedies of September 11. In crises like 9/11, we see just how vital our frontline protectors are. Firefighters, law enforcement, and healthcare workers are among the heroes who step up for us, and they often do so without thanks. I am profoundly grateful to people who use their brains and their hearts to make the world safer every day during the worst of Tuesdays like 9/11 or otherwise ordinary Tuesdays. One such person is my guest, Dr. Sara Krzyzaniak. Sara is a clinical associate professor in the Department of Emergency Medicine at Stanford, where she has been recognized as Mentor of the Year and Teacher of the Year, to name a few of her well-deserved accolades. I met Sara in the TEDx Palo Alto green room as we were waiting to be called on stage. She delivered one of the best TEDx talks I've ever heard, and I knew I had to interview her so you, dear listener, and I could both learn from her hard-earned wisdom. Listen in to hear Sara's stories and the important lessons she's learned from her years working in the emergency department. Dr. Sara Krzyzaniak, who has asked me to call her Sara, welcome to SuperPsyched.
Thank you. I am truly super psyched to be here. This is going to be fantastic.
Listeners, I am so psyched to be with you, Sara. First of all, we met basically in the dressing room or the green room area before a TEDx conference in Palo Alto a few months ago. And we were both kind of shaking in our boots because, green room, TEDx, how's it going to go? We've been working on this for some time and we've got basically 14 minutes to crush it. And you get on stage, and listeners, when I say, and you will see if you decide to look at the link to her TEDx talk, you will see that she absolutely hit it out of the park. And she talks about, and you talk about, in this case, I'm going to now address you rather than my listener. You talk about the idea that AI will not replace an ER doc and why. I've taken great interest in ER or ED, depending on who you talk to. I think the more current way of describing it is ED in the emergency department. How did you decide, of all areas of specialization, you could have gone any direction with this powerful MD degree? You decided to double down on emergency medicine. How did that even come about, first off?
Adam, it is a funny story. And again, your listeners that are old enough may remember that there was a show decades ago called Rescue 911 with William Shatner as the host. I mean, this was like the original true crime docu-series show before they were even popular. And I remember as a kid, like elementary school, I don't know what my parents were thinking. I don't know. I was like a child in the 90s where there was like, you can do whatever you want as a kid. And I would watch this show, and it basically followed 911 calls. And so that was, I think, my first experience to first responders, emergency medicine, that type of thing. And then somehow, again, as a child, we can do a different podcast on parenting styles of the early 90s, but I was given a computer game, right? So this is like the era of Where in the World is Carmen Sandiego, on these like massive computers that take up, like truly own the term desktop, these big computers. And I had a computer game that was something like Emergency Room. It was like called Emergency Room. And I literally had a computer game, again, as an elementary school kid, where you like got to find little, you had patients in an ER and you had to like think about what their symptoms were and decide what you wanted to do. So I think from a really early age, I was interested in this. Now, I went, so I did all the things. I was a pretty boring student. I went to high school, I went to college, I went straight into med school. But when I got to med school, I really wanted to explore different things. And so I considered different specialties. I really loved trauma surgery. But the idea of really like being in the hospital all the time, I wasn't in love with that piece. I really wanted to like dermatology because you know what? Dermatology is great. Great hours. And what really got me as a med student, the sample closets. They had these closets filled with like face creams and hand creams and all this great stuff. And I was like, sample closets, 9 to 3. But you know what? I didn't get the dopamine kick. I didn't get that like adrenaline rush of really sort of like being in the mix of things. And as I went through all of my rotations in medical school, the part that I really enjoyed was when whatever service I was on would send me down to the emergency department to see a patient that was getting admitted. So I really tried hard to like other things. I did research with an electrophysiologist on mortality rates with defibrillator placements. I worked with actually a dermatologist who worked with OBGYN cancer patients and the dermatologic side effects of their chemotherapy drugs. Like I really got into all of these things and I think gave it a very good college effort to find something else. But I came full circle. I came full circle to William Shatner and my emergency medicine computer game and chose emergency medicine. Because, you know, at the end of the day, there's two things that I found I really valued. One is I love a puzzle. I love getting clues, putting things together and coming up with an answer. I got super bored once we knew what was going on with the patient. Once I knew it was pancreatitis and then they got admitted and you spent that admission titrating medications and fluids. No, thank you. Let someone else do that. I was like, give me the pieces and let me put it together. The second piece that I realize that I really love is being there when people are in crisis. And sometimes that's real crisis. Sometimes it's imagined crisis. Sometimes it's not a crisis. But that responsibility, that heaviness of the job, I loved. And I really liked that. So those are the things that really brought me back to it.
That's amazing. So you're describing just basically going back to your roots, the thing that really was your gateway drug into medicine, so to speak. And I'm grateful to William Shatner because were it not for him, you would not be in this profession, perhaps. I find myself thinking about you being kind of like Dr. House at 78 RPM, like super fast. You get to go in, you get to solve the case, or at least figure out what the next stage is, and then move on. And you realize that was a fit. That's brilliant. Meanwhile, you're working these wild shifts. And by the way, just 2 other TV shows I just got to give a shout out to. First off, Scrubs, one of my all-time favorite shows. It's my comfort food. What Friends is for a lot of people, Scrubs is to me. I watch that and rewatch that. I love the relationships. I love the vulnerability of putting yourself out there and trying to heal people. It really relates to me as actually a psychologist. Yeah. And the other one over the summer, and I even did a special episode on it, was The Pit. Yeah. I don't know if you've seen Noah Weil play that role. And I want to ask you, how accurate is that?
It is shockingly accurate.
Oh, yes.
That's like the general consensus among the emergency medicine community. Emergency physicians feel seen. We're like, yes, this is what it's like. Now, they condense, for the sake of TV viewing excitement, they condense things into an hour. And there's probably not that much stuff that happens in an hour, but it is really, really accurate. And it's been well accepted now by the emergency medicine community that, yeah, they sort of nailed it.
That's so great to hear. And by the way, listener, I need to push back on something. You did not have a boring high school career. You crushed it in volleyball. So like you were just, I'm guessing, spiking the ball and tormenting other teams, not verbally, but
maybe a little bit verbally.
Athletically, you were probably kind of killing it. But I can just imagine you on a volleyball court, just not having a boring high school experience. And then you played, I believe, at the college level. So lest you be deceived, not boring. Anyway, let's talk about how AI is creeping up and how you hypothesize that it shall not replace the human interaction, at the very least, as it relates to the emergency department, perhaps other places. But Let's hear about your sense of things. Why will it not?
And I am not anti-AI, and I fully accept that AI has a role. And I do think that there are parts of medicine that AI will absolutely replace. And I use AI right now in my practice. It helps with listening to the conversations I have in a patient room, and it turns it into my chart. We have the electronic health record, which is a gift. We see so much information, but moving quickly, it can be hard to see everything. So it can help me distill that information. It can help me look at all the data and make sure I'm not missing potential diagnoses. So all of those things are really important. But what I find is that maybe, and this is a little bit more unique to the emergency department, it's been a while since I've worked outside of the emergency department, but patients really want to be seen, and they want a person to be there with them. They want someone to be present with them. And I think that's a part that AI can't replace. It can't replace that human presence that we need and that our patients need. And then there's parts of what we do that really require something that, at least right now, AI doesn't provide. Now, I will say some of the feedback I got after my TED Talk was, no, you're wrong. AI is doing this. AI is making some of these judgment calls. And I do think that there's a world in which AI is going to start helping us make some tough decisions. But right now, we're not there. So if you take the scenario I talked about in my TED Talk of somebody dying in the emergency department, deciding when it is time to stop, when do we stop trying to revive this person or save this person? It's a really tough decision. And it's very rarely black and white. And so it takes a lot of judgment. And often we think about the patient and what their wishes might have been. We talk to the family. We say, what would they want at this point? Would they want us to keep going? Do you want us to keep going? Here's what this looks like if we keep going. Here's what the outcomes might be. And those aren't things that right now AI can do. So that's just one example of, I think, a way that AI won't replace us. And it's in those really heavy emotional moments.
What a brilliant rendering. And if you were to perhaps be the prescriber, which you are in other areas, but I'm going to ask you to prescribe the right amount of AI versus the right amount of human interaction, what would be your sense of, if in a perfect world, what would AI do and what would humans do?
What I think is that if the perfect amount is the amount that the patient never sees, it's the amount that the AI is working in the background and it's helping the physician, it's supporting the physician, it's giving us some tools that we need to make decisions. But from the patient-facing side of things, all they see is their doctor. All they see is the person sitting next to them, making eye contact, pausing. And the moment that the patient knows that AI is involved, I think it's too far.
I'm watching Tour de France on Netflix these days. Have you ever watched it?
I have. I'm not caught up with the recent ones, but I've heard a lot of people.
It's pretty great. So the reason I bring it up is all of the writers have their managers in their ear, their coaches speaking to them. The coaches aren't doing the writing. The writers are doing the writing, but the coaches are able to say the magic words. And as I hear you say that, I hear a parallel idea. And that is that the AI would be in the ear, assisting, but not deciding. The ultimate decision comes from the human, is the way I kind of hear it. And the interface is that the human is assisted by AI, but not dictated to by AI. I don't know. Yeah. What do you think?
Yeah, I would agree. And again, I paused in my answer there because I do think that there are the AI enthusiasts that would say no, that would disagree and say, yeah, no, the AI can do all of that. And maybe I'm a late adopter. Maybe I'm that person that you're going to peel me, my claws still holding into this, traditional role of the physician in medicine. I'll be one of the last ones standing, but I still really believe in that role of the physician, of being there and helping to make those decisions. And a big part of medicine is also that we've really shifted from this paternalistic model where doctors make the decision and that is what you as the patient have to do. And we've really now come to sort of have this bidirectional conversation with patients and make sure that the things we're recommending or the decisions we're making align with what the patient wants to do. And sometimes that's really easy to tease out, and sometimes it's not as easy to figure out what patients want or what their goals are.
So one of the true strengths of your TEDx talk was that you shared stories of what real life ED world is. Can you describe a story or two of you as a human interacting with other humans, what that looked like, and how your humanity added to good medicine?
I think, again, I come back to it and I don't give these examples to be overly dramatic, but I really think that, the most sort of profound moments come at the end of life. And we all face dying someday. It's going to happen to all of us. And I think, some of us probably think about it more than others. What does death with dignity look like? How would we want our last days to be? The reality is that we can't predict that and we can't control that. And so I think some of the things that come to mind, and in fact, one of the experiences that really stands out to me was when I was in my training and we had a patient who was in the hospital, they were in the ICU, and they had signed their advanced directives. They said, I don't want a breathing tube. I don't want to have the compressions done. If it's my time, it's my time. And I just want to be able to pass. And this was a person who had a pretty bad head and neck cancer and had progressive airway obstruction. And she was at the end of her disease progression to the point where it was causing really significant airway compression and she couldn't breathe. And it got very serious. And I remember the doctor I was training under brought the family member into the room as their loved one was struggling to breathe and said, what do you want us to do? If we don't do anything, she's going to die. And in that moment, of course, that family member says, I'm not ready. You can't let her die. And so we do all of these things for this patient. And it really struck me because patients make these decisions for themselves when they're of clear mind and they have an idea about what they want. But when that moment comes, especially for the people who are in the room or watching their loved ones suffer or have sort of these last moments, that's really difficult. And so navigating that with the family, it really struck me because I thought, gosh, we did all of these things for this patient that she told us she didn't want. But in that moment, the family member was like, you have to do something. You can't let her die. And that's what the team did. That sticks with me. And I think about that with families a lot. And I see my role as a physician, not only in helping the patient, but in helping families and navigate that end of life process where you've signed that paperwork. Maybe they're on hospice. They thought that they wanted to go home and die at home. But then that moment comes and family says, we're not ready. We can't handle this. And really helping them navigate honoring the patient's wishes while also not letting them feel like they haven't done enough. They haven't tried everything they could to save their loved one, and saying this is the most honorable thing you can do for this person that you love is allow them to have this piece of autonomy to say this is how they want this to be. So I think those are the moments where I really find that navigation and that communication to be so pivotal.
This is why I thought yours was the best talk of the day. For me, it was the one that really hit me the hardest. You really speak to what people are able to do for people. And here you are, you're a physician, you were educated with an MD, a very, very, it's rarefied air. So you've got these technical skills, and that's really what any good medical school is supposed to provide for you. And yet you're also speaking about the ability to speak to people during the roughest times, the worst days of their lives. And at times, it almost seems like choose one. Do you want the technical skills or do you want the human skills? it almost seems like you can't have both. You need to have both. I'm wondering, in the midst of it all, by the way, you're underslept and you're overworked. It's a really, really demanding job. It is a Tour de France.
Mm-hmm.
And you also have to be saving lives and communicating with the patient and their families. And that doesn't seem like something that AI can do. I don't think I would be comforted by a cute emoji talking to me or some pseudo-human. I would want someone like you talking to me during that darkest hour. What have you learned through these? I mean, I'm sure that you have a gag reel of the times that you screwed up, because we all do. Anybody who's been through an internship of any kind has known that they've had some belly flops. Mm-hmm. And yet you have had now hours and hours of practice. What are some of the things that you've learned about kidding with people during their toughest hour?
One thing that I've learned, and it's probably partially just getting older and gaining life experience, but also the experience I have after doing this for nearly 20 years, which is really giving myself the grace to understand where other people are coming from and not looking through those decisions through my own lens and how I see the world and what I would do or how I would approach the situation, but really stepping back and thinking, gosh, how is this from this person's perspective? When people say things or want to do things that I think seem sort of crazy, I've been able to check myself and say, instead of having this response to say, that is a bonkers idea, I can't believe you're doing this. Internally, I step back and think, why do they want us to keep going? Why don't they want me to tell their family member that they now have metastatic cancer that they didn't know about and that this abdominal pain isn't just an ulcer? And really trying to understand where patients are coming from. I think that's the thing that as I've progressed in my career, that I've allowed myself that time and that space to say, okay, this isn't about me. The technical skills are about me. That's what I know. That's what I can do. I don't need patients to weigh in on my technique of doing a central line or a chest tube. But what I do want them to weigh in on is, what's our next step? Where do we go from here? And really trying to let them lead that discussion.
You heard a long pause for me there. Because this is about perspective taking. This is about empathy. This is about really, really taking a moment in the midst of a very high pressure situation and saying, I'm going to tune in on a level to this human being who's having probably an out of body experience. Common vernacular, they are tripping hard. And I also need to figure out in very kind of quick order how to communicate with this person so that they feel heard and that they actually can make a good decision in this moment. They may be, as you said earlier, the person who's in charge of the advanced medical directive, and they need to be able to act on behalf of their beloved.
And people come to those conversations with a really wide variety of experiences and understanding. And, some people are drawing it from Scrubs or House or ER, the, original.
The OG.
Yeah, the OG. And some of them come with their own personal experiences with the healthcare system. And so again, we all come to decisions in life with the baggage that we carry from a variety of different things. And again, it's rarely as simple as saying, here are the facts, and this is the logical next step, because life isn't logical and death certainly isn't logical. And trying to make it logical is where things fall apart and where trust erodes, and then people feel like something went wrong.
It's interesting because Amos Tversky and Danny Kahneman, who came to the study at Stanford where you are currently practicing, actually showed through psychology and behavioral economics that human beings are on average not all that logical, even though we think ourselves to be super logical, especially in this context. It's very hard to be logical when you're in the midst of this level of stress. So just amazing. And just also, just as you're talking, as you're describing a procedure or two, the number of procedures you have to be able to do as an emergency medicine physician are so vast. I'm just going to say, from the outside, as a muggle who's not a physician, but the other kind of doctor, a psychology doctor, it seems like you would have to have more arrows in your quiver than almost any other specialty. Is that accurate or somewhat? I'm not bagging on other areas of specialization, but I'm just thinking about the vast number of arrows you need to have in your quiver. It would seem like it's maybe more than just about any other specialty.
It's hard, there's like the quality and the quantity and, all of these different things. We certainly have a lot of procedures we have to be able to do, and some of them we do on a fairly regular basis and some we do very rarely, but we always have to know how to do it. In fact, I'll tell you, just this morning, I was running a simulation with our residents because I run our residency training program here at Stanford. And the simulation lab is a great place to go through and run some of these infrequent scenarios that we don't have necessarily in rote memory, but that we need to be ready to respond to. And the scenario today was a 3-year-old with a gunshot wound to their chest abdomen area. And it required our EM physicians to do 2 different types of chest tubes in the chest, to do blood transfusions, to drill an IV into their bone so that there was a place where we could give them the blood that they need to get them up to the OR where our surgical colleagues can do the definitive management. We don't see a lot of that in general. There's a few pockets in the country that are going to see a high volume of penetrating pediatric trauma, but most places don't. But that doesn't mean that you don't have to be ready and that couldn't roll through your door at any time.
At any time. Sara, I'm just walking in your shoes, and I imagine they have to be very comfortable and really supportive shoes as you're walking through the ED, through God knows how many thousands of steps you take per day. I'm sure you have something measuring those, some biometrics, whether it's an Oura Ring or an Apple Watch. What are your best practices to keep yourself physically and mentally acute throughout the day? So describe your hydration, your nutrition, your physical activity, perhaps meditation. What do you do to keep yourself in tip-top shape so you can make it through the day and basically kick ass?
It's a great question. And I think this is a skill that I continue to try to hone. To your point, hydration is key. We're walking around, we're talking a lot, often wearing masks, getting dehydrated. So hydration is key. I drink caffeine of a variety of different sorts, but I try to do it early in my shift and then switch to water. I'm also on an infant feeding schedule. I need to eat every 2 hours. And so most of us never step away during an 8-hour shift to sit and have a meal. But I always have 3 or 4 things that every couple hours I'm grabbing it and I'm just taking a few bites and I'm eating something and I'm keeping myself. But one of my mentors, when I was a resident, gave me this analogy that I still use for myself to this day, as well as to my residents. And he said, you start your shift with 5 happy cards in your deck. Start your shift with 5 happy cards. And throughout the shift, people take away those happy cards. A patient yells at you. You put in an order wrong and you get scolded for putting in an order wrong. You have to deliver bad news to a patient. And if during your shift, you look down and you realize your 5 happy cards are gone, you have to find a way to refill that. And so he would say, just walk outside, take 30 seconds, stand in the sunshine, put your face up to the sky, close your eyes. For some people, it might be just put your AirPods in and listen to that song that jazzes you up and that recenters you. Treat yourself to a candy bar, whatever it is. Everyone's a little bit different, but you have to find a way to refill those happy cards. And some shifts, I start with 5, I end with 4, and it's a pretty good day. Some days I start with 5, and within an hour, I'm oh my gosh, my happy cards are gone. So there's the core fundamentals. You got to eat food, you got to drink water, but you have to have those happy cards.
I think that's absolutely brilliant. What is your song?
Oh, I will tell you, it's the song Anastasia by Slash.
I love Slash. He sings it, or
yes.
You were talking Guns N' Roses Slash.
Yes. Slash, Anastasia. And it just is this hard rock ballad that I'm just yes, I am ready to go back.
So if this was the MLB, this would be your walk-on song before you're getting up to bed. Song. Okay, sweet. As I have mine, and It's typically been
What's
Lil Nas
yours?
X and Industry Baby, but there's an Italian song by my favorite musician in the world who I just have such a love for, Giovanotti. Currently, it's La Mia Gente. It's this song that just, I'm not much of a dancer, but I will dance to that. Anyway.
Ew. Okay, you'll have to send that to me because I'm always looking for new songs to get me hyped up and to refill those happy cards. So,
hell yeah. This is a song that will make you very happy.
Okay.
Amazing. Your husband is a firefighter.
Yes.
You are an ED doc. These are high stress positions. I'm wondering, before we even get into the relational aspect, just how do you attend to yourself after something goes down, somebody dies during your shift? How do you apply self-care? How does he apply self-care? How do you care for each other when one of you needs a little something because you've seen something that sucked and is kind of beyond the pale of the ordinary human experience?
A couple of things. One is you have to be able to be vulnerable with someone. Sometimes it's hard to be vulnerable with your coworkers because you feel like you're supposed to know everything, or saying I messed up is really hard, or saying I'm really sad. That's hard, right? Because we're not supposed to really be sad. We're not supposed to, right? I mean, I give the example, I remember resuscitating someone who drowned in the ocean trying to save their child. And we tried for hours. We just worked for hours. And ultimately we couldn't. And I walked into the room and I broke the news to that person's family, including the child that they had gone in after. And I walked out of that room and just had to collect myself and go see all the rest of the patients. And so we are taught that we have to just put it all behind us and we just have to move on and see that next patient. And we never shut the doors of the emergency department. The patients keep coming. So you have to, at some point, be able to say, that was really shitty. Can I say that on your podcast?
You can absolutely say shitty on my podcast.
And so there's a lot of different ways that people find opportunities to do this. So I think that's for us, is being able to come home and say this. And now my husband was not always in medicine. And there is the great protective factor where when I would come home, we wouldn't talk about medicine because by the time I had to explain the way things work just to get to the story of what happened to me that day, I was like, no, it's too much. I'm tired. But now that he is in this similar field, it's actually great because I don't have to really go into detail because he's been there and he's seen it.
I love that you brought up vulnerability. I was talking to a professor at Clark University on the idea, James Cordova, I'll just give him a shout out, amazing human being who wrote about intimacy. And I asked him for definition of intimacy. And you just basically said it. And he said, it's vulnerability met well. So the ability to say we're sad. Yeah. In the United States, we're not supposed to say we're sad. This culture doesn't really support that notion all that well. We're supposed to be happy and, forward moving. And that's in crushing it and living our best lives. But the fact of the matter is, when you've tried to revive someone and you couldn't, come on, what are we talking about here? And you gave it your all. And it's hard not to take that on as your own failure when there was literally nothing else you could have done. And it's come on. And how many times have I had these erroneous thought patterns for things that are a million degrees less intense than what you just described? And the ability to just kind of, okay, I did the very best I could. I left it all in the field and still didn't get the result I wanted. How can I live to fight another day and protect other people? And that is, I'm guessing, I'm trying to phrase your life as I see it, but I don't know. What do you think? Was that accurate or is that inaccurate?
No, it's very accurate. But I think the one extra thing I'll add is sometimes hearing you did everything you could, there's nothing else you could have done, although it's true, isn't the most helpful thing. And instead just being having someone to say, you know what? That sucks. That's really hard. I know you feel bad. I wish I could help, but I'm here for you. I know that's bad. My default, everyone that works with me knows this, that I try very hard not to do this. I'm a fixer. I want to fix things. I want to fix you feeling sad. I want to tell you the things that are going to make you not feel sad. But really, sometimes all we need is for someone to say, yep, that's the worst. That's horrible. If you want to talk through it, I'm here for you.
I love that so much. And I'm remembering a scene in Parks and Recreation. I don't know if you watched that show.
Oh, love that show.
So you remember the ever sunny character played by Rob Lowe, Chris, and he's together with Anne. And Anne is really struggling in her pregnancy. And she's like, shut up, dude. I just want you to tell me that sucks.
Yes. Yes.
And he finally is able to say, that sucks. And the healing of just sitting with somebody in a sucky moment, that is such a powerful gift.
Yeah.
Because you even heard it in my own voice. I was rescuing you. I wanted you to hear from my voice. There was nothing else you could have done.
Exactly.
And ain't that right? And so there was a part of me that wanted to rescue you in that moment. Mm-hmm. And you're just saying, dude, all I need you to do, if you were in that moment with me, it would be to say, that sucks. And so much of what therapy is about is sitting with people in that moment. And I failed to do that in that exchange because I felt like, here is this wounded healer. And anyway, I'll have to analyze this later. But suffice it to say, I felt the desire to, quote, come to your rescue. And I think that's a very human thing. And all you needed to know is, wow, yeah, if that had been in the moment, yeah, that sucks. And I think that's very illustrative to other people. Just this very week, I was dealing with a sucky situation and somebody tried to throw me a bone in the midst of that. And I was like, yeah, that's not what I needed. I just needed to know that that sucks. So note to self, that was a little belly flop that I just had. And I love what you shared for my listeners. Is there anything I should have asked but haven't yet asked?
I mean, no, I could talk about this forever. I love my job. I find so much joy in what we do, even in the hard moments. I think that's what keeps it different and interesting and challenging. You know, that challenge. I will say the one thing, well, I was going to say maybe two things. There's a couple things that it has changed for me, which is that I try very hard and really sort of default to not taking things for granted. Our health, our life, it is the number of times I have seen a life snuffed out for no reason. You know, the person driving home from the grocery store that just gets hit by a driver that runs a stop sign and they die just to the grocery store. And I think it helps me love deeply because I just appreciate every moment I have with the people I love, because you just don't know. And I think we're reminded of the frailty of life all the time. Emergency doctors then also have a running list of the things that they'll never let their kids do. It involves things like trampolines, having a pool, riding motorbikes, you know, like there's a very long list, eating grapes, you know, like there's all these things, like there's this very long running list of, you know, sort of tongue in cheek that we won't let kids do or loved ones do. But yeah, I think that's the other thing I would share that has really impacted me through my job is just appreciating what we have, the life that we have, the health that we have.
Such a poignant reminder of just how fragile we are, to borrow a song from Sting. We really, I mean, just, and we take so much for granted. And of course, we're going to be fine, except for maybe we're not. And you, given your world, you see and you can appreciate far more just how fragile we actually are. That a grape or a swimming pool or a trampoline, which all should be joyful, might not be.
Yeah.
And that we could be at the wrong place at the wrong time.
Yeah.
So thank you for that. It's my hope not to be a downer as I share this. And I know that's not your intention either, but to rather cause us to celebrate how amazing life actually is and how precious it is to have a moment that we might otherwise take for granted and just look down at our smartphones when a beloved is in the room with us. All right, sister, here's the final magical question that I ask everybody. And put on your seatbelt, Sarah.
Uh-oh.
if you had the magical power to confer upon all humanity one insight or skill that would dramatically improve the life of the individual, and perhaps, since we're all connected, the lives of people near that individual, what would that skill or insight be? And how do you imagine it would impact the life of the individual as well as perhaps the people around that individual?
I would say compassion.
Hmm.
Because when you have compassion for, first of all, for yourself, to forgive yourself, to give yourself grace, to allow yourself to take a step the wrong direction and come back to the path, that's huge. But again, as someone that sees all walks of humanity and all walks of humanity interacting with each other, compassion for others, recognizing we don't know everyone's road that they've been on, how they got to where they are today, that people genuinely, I do believe this, truly want the best for others and for themselves. Sometimes that gets clouded because of other things that get in the way. But I do think that deep down, that's what humanity wants for each other. And we forget that. I would have a compassion magic wand and bestow that upon everyone.
I love that so much. And a lot of people think that they have to come up with something original. And I think it's far more powerful when people say the same thing that other thought leaders share on this podcast, because it just somehow, I love the word compassion. I think you're right. The research really, really supports that idea. And I want to just thank you for choosing emergency medicine. I want to thank you for sharing your wisdom with the TEDx stage and now with my listeners. You bring so much to the game of medicine. And it's my hope that the human touch will always lead the way, and that will only be assisted by AI for the betterment of the human touch. And my God, should I ever have to be in an ER room or an ED room, I hope to be treated by you.
I hope to not see you there.
I hope not see you there as well.
if you're there, we will make sure you're taken care of and give you the most compassionate, patient-centered care that we can.
Right on, Sarah. This is Dr. Adam Dorsay thanking you for listening to SuperPsyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.